healthier, more youthful looking skin, stronger, healthier bones and joints, stronger and healthier heart and blood vessels using natural methods such as nutrition. That's what this video is about. My name's Dr. Anglen. In my life, I've earned several degrees and certificates. I have a 4-year undergraduate bachelor's degree from Park University in Parkville, Missouri in nutrition, and I was on the Dean's Honor Roll. I graduated from chiropractic school with a doctor of chiropractic, and I own several offices over 15 years. I've been certified and licensed to do acupuncture since 1992, and in 2006, when I was 45 years old, I graduated from medical school with an MD. And this is a very informal video like I would send my friends. It's also easier for me to just film this. I make a lot of videos to amuse my friends and make them laugh on Facebook. This one's more educational. And I want to discuss how to get your body to produce more collagen, because I think collagen production is the key to aging well. A lot of people, when they talk about anti-aging medicine, talk about hormones. I do think that's important, but I think for a youthful, healthy, strong body, collagen is the key, because collagen makes up so much of our body. Bones are not primarily calcium. Bones are made up of bone matrix, a large part of which is type 1 collagen. There's different types of collagen. There are women who get collagen injected in their lips or their cheeks to plump them up, get rid of wrinkles, and to make them look more youthful. Collagen is a protein. It's soft and flexible, like a hot dog. There's different types of collagen. The type that's in bone is called type 1 collagen. And when I was going through medical school to pass my boards, I was taught to remember to put a B in front of 1, and it spells bone, and that reminds me that the type of collagen in bone is primarily type 1. And in the bone, you've got minerals that are hard, like calcium. Calcium makes up coral, and it makes up chalk. And then you've got collagen that they bind together and make bones hard and flexible. If you took all the minerals out, if you took calcium out, you'd be left just with collagen, which is soft and flexible like a hot dog. A lot of people think osteoporosis is the loss of calcium from bones, but it's not. If you lost the calcium from your bones, they'd be flexible and your bones would bend. That's known as rickets, and kids who have rickets often have bowed legs because they don't have enough calcium in their bones. If you took all the collagen out of bones, you'd be left just with the minerals like calcium, which is what chalk is. Chalk is just calcium, or a Tums pill. And if you took chalk, you can snap it in two. It's brittle. Osteoporosis is also known as brittle bone disease. And so if you take the collagen out and leave the calcium, bones become brittle. So really, osteoporosis is more the loss of matrix, which is largely collagen. Vitamin C is the key here. I want you to remember vitamin C when it comes to collagen. In a study that was published in 1991 by Peter Tchaikovsky in the American Journal of Clinical Nutrition, they showed that vitamin C is what's needed to make collagen. And we have a lot of collagen in our skin. Sun destroys vitamin C in our skin. Smoking destroys vitamin C in our skin. And so people who smoke or get a lot of sun exposure, their skin gets really messed up because they don't produce collagen as well because the vitamin C is destroyed. Our body produces procollagen from amino acids like lysine and proline by hydroxylating them using vitamin C to make that collagen from to make those amino acids into procollagen so our body can make collagen. Vitamin C is the key here. They also showed in that research paper that putting vitamin C on our skin helps the dermis produce more collagen, making the skin thicker, better hydrated, more youthful looking. And they found that a topical solution that was 20% vitamin C was the best choice. And the type that I recommend is known as ascorbyl palmitate. And ascorbyl palmitate's fat soluble. I recommend mixing it in coconut butter and applying it to the skin. In a 2005 study published in Indian Pediatrics, and the study was called Absorption of Oil in Preterm Babies, a pilot study. They found that if they put coconut oil in the skin, they could show that the coconut oil went into the skin. It actually was absorbed. So mixing the ascorbyl palmitate with coconut oil is a good way to get it into the skin, and I do that myself. And the vitamin C will get in there and cause the production of collagen in the dermis of the skin. But vitamin C does so much more than that. The arteries in our body that carry blood away from our heart to every part of our body are thick, and they have 3 layers. The outside is called the tunica externa, which is very tough and rubbery. The middle is muscular, and it's known as the tunica media or the tunica muscularis. And then the inner lining is soft, and it's like Teflon coating on a pan, called the tunica intima, and it keeps blood and things from sticking in there, so they whisk along really fast. Collagen is what makes up those materials largely. And if you don't have that collagen, those blood vessels can get very weak. There's a clinical condition known as scurvy. Pirates used to get it, and they would insult each other by being like, "Hey, a scurvy dog, arr." And they got scurvy because they didn't eat things with vitamin C on their long voyages. And then they learned that if you take some fruit like a lime and eat a piece of lime every day, you'll get enough vitamin C and they wouldn't get scurvy. And some of the symptoms of scurvy is they would just bleed and bruise easily, or their joints, like their knees, would fill up with blood because their blood vessels would get weak. They'd lose teeth because the bone around the teeth would dissolve and demineralize and their teeth would just fall out. English sailors were known as limeys, because they'd be eating limes, because the vitamin C in the limes would prevent scurvy. In fact, vitamin C is called vitamin C because of the C in citrus. Limes are a citrus fruit, and so vitamin C comes from citrus, they discovered. So stronger, healthier blood vessels where you don't bleed and where the blood vessels are strong is helped a lot by vitamin C. In a 2004 study published in the Medical Science Monitor by Eli, the study was called Aneurysm, Prevention and Non-Surgical Repair. An aneurysm is when an artery gets weak and starts to balloon out, and it can blow up and rupture. The biggest artery in your body is called the aorta. It comes out of your heart, travels down the center of your body, and basically all the blood vessels, with few exceptions, come right off of it. It's big. In me, it's probably that big. If somebody's aorta ruptured, they could lose gallons of blood in a few minutes and be dead within minutes. Aneurysms are really bad, and they need surgical repair. But in this study, they found that slightly larger doses of vitamin C can prevent aortic aneurysms from deteriorating and getting worse, and it can even cure the large ones without surgery. And when they say slightly larger doses of vitamin C, they mean over 1 milligram per kilogram of body weight. I weigh about 210 pounds, so I'm like 95 kilograms. And so for me, it would mean over 100 milligrams of vitamin C a day. I take between 250 and 500 milligrams of vitamin C. And so the vitamin C produces more collagen, which keeps the artery strong. And if they're already having an aneurysm, it can keep it from getting worse. And it can even repair it without surgery, because we rebuild that collagen over time. This isn't to recommend using vitamin C to treat an aortic aneurysm if you've been diagnosed with one, because it can blow up and be very severe, and I recommend listening to your surgeon on that. But this is about the health of your blood vessels. In another study that was in Medical Hypothesis this year in 2016, titled Arterial Tortuosity Syndrome Reveals the Function of Dihydroascorbic Acid in Collagen and Elastin Synthesis, Implications for Skin Care. So, ATS, or arterial tortuosity syndrome, is when an artery gets kind of weak and doesn't maintain its integrity and twists all up. It gets tortuous or twisty.